Good morning. This is Dr. Tariq. Today I am going to discuss medical terminology of gastrointestinal system. I start with the word or. Or mean mouth, oral, oral tablets, oral capsules. Pharynge, pharynge is throat. Pharyngitis, infection or inflammation of the throat. Pharyngoplegia, plagia, paralysis of the throat. It happens in hemiplegia. Pharyngectomy, surgical removal of the part of the muscle of the throat. Esophagus. Esophag is the word root for esophagus, that is food pipe. Esophagitis. Dysphagia. Dysphagia is difficulty in eating. Aphagia. A means no. No eating. Aphagia, dysphagia. Difficulty, no eating. Stomach. Gastritis, infection of the stomach. Gastroscopy, internal visual examination of the stomach. Internal visual examination of the stomach. Gastrorexia, rupture of the stomach. Gastrorrhaphy, stitching of the stomach. Gastrectomy, surgical removal of the part of the stomach. Enter. Enter means small intestine. Entero, small intestine. Enteritis, gastroenteritis, inflammation of the stomach and intestine. Both are involved in this inflammation or infection. Gastroenteritis, and there is a subject which is known as gastroenterology, study of the disease of the stomach and small intestine. And gastroenterologist, this is a specialist of the system who diagnose and treat the disease of gastroenteritis, stomach and intestine. Next are two word roots, colo and colono. Both are word roots for large intestine. Colitis, colectomy, inflammation of the colon, surgical removal of the colon. Colostomy. Stomy means making a surgical opening between the organ and the body outside. For example, this is large intestine. We will cut it and bring it here and make a surgical opening on the skin. This is on the skin, and then attach a colostomy bag with it. This is hanging on the side of the patient, and feces are coming here, collecting here. This is colostomy bag. This is colostomy. 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 Col and stomy. Col and stomy. Colostomy. Surgical opening between the organ inside and the body outside. And we attach a bag, colostomy bag. Feces come here. They are not going this route. They are not going this route. Feces are not going here. They are going, and this may be removed or may be removed later because there is cancer somewhere here or up to the rectum somewhere. So feces should not go there. They remove this part and make a hole here. Feces instead of passing through the rectum, they pass through the colostomy. This is colostomy. Similarly, we can bring ileum here and make a ileostomy. Ileostomy. If the whole colon is problem, then we can do with the small intestine. Ileostomy. Next word is col. Col is bile or gall. Cholecysto. Cholecyst mean gallbladder. Col is gall and cyst is bladder. Cholecysto gallbladder. Cholecystitis, infection of the gallbladder. Cholecystectomy, surgical removal of the gallbladder. Cholelith, stone in the gallbladder. There are two more words here. I want to show you here. This one, colidoco. Colidoco means common bile duct. Colidoco. Colidocolith, stone in the common bile duct. Colidocolithotomy, making a surgical puncture or entering into the common bile duct to remove the stone. Colidocolithotomy. Then word is cholangio. Cholangio. Cholangio means biliary passages in the liver. Cholangio. There is infection occurring inside these vessels. This is known as cholangitis. Cholangitis. This is the infection of biliary passages through the bile comes into the gallbladder. Here I want to tell you one thing. Gall or bile is not a production of gallbladder. It is produced by liver. But gallbladder is a storage house. It's a storage tank. So it is stored in the gallbladder but produced in the liver. And cholecysto, I told you this is gallbladder. Cysto means bladder. So we have two cysts in our body. One is cyst, only cyst, and one is cholecyst. Only cyst is urinary bladder and cholecyst is gallbladder. If it is only cysto, it is urinary bladder. If it is cholecysto, it is gallbladder. Lithiasis, state of having stones or condition of having stone. Lithiasis. Lith is stone, isis is state of or condition of. Pancreat. Pancreatitis. Pancreatectomy. Pancreatectomy. Infection of the pancreas and surgical removal of the pancreas. Insulin is produced in the pancreas. Emesis. Emesis means vomiting. Hematemesis. Hematemesis. Vomiting of the blood. Heme is blood. Emesis is vomiting. Hematemesis, vomiting of blood. Hyperemesis gravidarum. Hyperemesis gravidarum. Excessive, hyper means excessive. Emesis is vomiting. Gravidarum is pregnancy. Some girls, when they become pregnant, they have excessive of vomiting in the first 3 months. This is known as hyperemesis gravidarum. Hyperemesis gravidarum. Excessive vomiting due to pregnancy. First 3 months of pregnancy. Rexia, appetite. Anorexia, main condition of no appetite. Anorexia, no appetite. Lingu and gloss, these are two word rules for tongue. Glossitis, glossectomy, sublingual. Glossitis, glossectomy, sublingual. Gingiva, gum. Gingivitis, gingivectomy, surgical removal of the part of the gum. This will regenerate by itself like liver. Odonto. These both word roots for teeth. Dentist, odontist. This is dental surgeon. Now PEPS and Pepto. PEPS and Pepto. This means digestion. Dyspepsia, difficulty in digestion. Dyspepsia or painful digestion. Now we go to here, this page. Halite. Halite is the first word. Halite means breath. You might be remembering halitosis. Halitosis. Halitosis means bad breath. Osis is abnormal condition. Halite is breath. So abnormal condition of breath means halitosis, bad smell. Pyro. Pyro means fever or fire. Fever or fire. Pyrosis. This is burning in the stomach. Pyrosis. Hyperpyrexia. High fever more than 105. Hyperpyrexia. Then is bulimia. This is binge eating. Binge eating. First was anorexia, no eating. This is binge eating. Bulimia. And there is another word here, bulimia nervosa. Binge eating followed by psychological behavior of taking laxative or purgatives and diuretics. Phago. Phag means to eat, to swallow. Dysphagia, difficulty in swallowing, difficulty in eating. Dysphagia, difficulty in swallowing, difficulty in eating. Aphasia, no swallowing, no eating. Pepsia, digestion, we already did it. Dipsia, next is dipsia, Dipsia. This means thirst. Dipsia, thirst. Polydipsia, too much thirst, too much drinking. Polydipsia, excessive drinking or too much drinking. Odont we have done. Spleen. Spleen is word root for spleen. Spleenitis, infection of the spleen. Splenomegaly, enlargement of the spleen. Splenorectomy, surgical splenorexis, rupture of the spleen. This can happen during accident, and we have to we do splenectomy, we remove it, or we surgically repair it. Splenoplasty. Rexia, appetite. Anorexia, no appetite. This is all for medical terminology, GIT. Thank you very much.